I want to welcome everyone. My name is Dr. Marina Mahoney. I'm Special Assistant to the Dean and Director of Assessment and Accreditation in the College of Education. And I have been chair of the symposium for many, many years now, probably 10, 12 years. And before we get going, I just want to give a thank you out to Dean Donwachuku, Ms. Diana Quijano, and Mr. Michael Dean Ignazio, who have helped organize this event and support this event for us. But most of all, I want to thank the students and our faculty sponsors and our student presenters most of all. For those of you that have known me, and Cassandra, I think you volunteered at one of these events once when you were working as a GA for us.
Yes, I do remember that.
You do, yes. So Sandra's heard a little bit about this before, but this is my favorite event that we do. And this is our first time doing it virtual. With the scramble to get off campus last year, we were not able to hold this event. So I will please ask that your little patience and for your understanding if we do have any tech issues as we're going through anything. We've tried to troubleshoot and foresee as many issues as we may encounter, but we just ask for your patience ahead of time. And if we were on campus, we would be welcoming you with food. We usually hold this event down in the atrium, and it's a very social event. And we get the classes, we get students, we get a lot of traffic coming through. So it's a very different event that we're holding this year, but we're going to make it a great one. It's going to be small but mighty. And of course, anytime that I can talk about research or methodology or data analysis with students, that's a good day in my book. You know, doing assessment and accreditation, this is my world. This is where I live. The fun thing about this event is that we get to learn about our students and the impact that they're making in our local communities. You are the educational leaders, and you are preparing our future leaders. You know, as you're aware, you know, San Bernardino and Riverside counties are our service areas. We work with over 100 school districts. We work with over 1,500 schools and clinical placements. So please do not underestimate the impact that you are having, whether it's in your clinical work or your research work. Okay. And this is why our symposium is one of the hallmark events of the college. We as faculty and staff get to see what our students are out there, what is important to our students and what is important to our communities. And this event is a supportive event. It's not meant to be, we're going to tear your research apart or anything like that. We welcome students at any stage in their research progress, from a beginning idea to whether they have their data collected to results. And we're here to be supportive and to offer feedback and congratulations all around. And obviously we're here to support you. You're going to go out, you're going to be awesome leaders in the Inland Empire and beyond. And we want to congratulate you on all of your accomplishments, both in the present, past, and the future. You're going to be excellent leaders out there and ambassadors for the CSU. And on that note, I'd like to introduce Dean Donwachuku and ask him to say a few words for us.
Thank you, Dr. Mahoney. Welcome, and thank you all for joining us for this 18th Annual Research Symposium, sponsored by the California State University San Bernardino College of Education. My name is Chinaka Donwachuku, and I'm the Dean of the College of Education. This academic year has been a year troubled with a global pandemic, the kind of which has not been seen in generations. And because of the pandemic, many research projects were halted. And those who dared to continue to do research amidst all kinds of obstacles and challenges must be complimented. For all of you who have worked hard and carried through with your research projects, I give you a sincere congratulations. Your tenacity and focus paid some dividend. Today's symposium is a testament to our persistence and endurance as a college to continue to engage and deliver on research and best practices despite the challenges we face. For that reason, I would warmly appreciate the faculty members who continue to work with their students to get them across the finish line. I also want to express my gratitude to Dr. Marita Mahoney and Diana Quijano, who have been the lead in organizing this annual celebration year after year. Thank you for daring to make this happen this year. Again, let me thank all of you for coming, and I hope you enjoy this time together, sharing and discussing good research. Thank you.
Thank you, Dean Don Wachuku. Okay, so this evening we have a variety of presentations, some posters, some PowerPoints, and some videos. The presentations are set up for the presenters to speak 3 to 5 minutes, and then we'll have approximately a 5-minute Q&A session. We're a small group, so we don't have to worry too much about sending on those timelines, but we will want to try to stay somewhat within those timelines as well. I will ask that if you are sharing a video, when you do share your screen, please remember in the lower left-hand side of the share box to check this share sound button as well. I have made that mistake many times. My video will start playing and there's no sound, so I'm speaking from experience. One of our presenters, Joanna Hargis, is not available to present tonight. She was unable to join us. So we do have a total of 7 presentations, and they are all from the School of Psychology program. So congratulations to Dr. Ward and to WAC and the School of Psychology program students. So awesome.
Good job.
Yes. Miss Diana Quijano is going to act as our moderator. So if you do have any questions for the presenters or any comments, please use the participants button to raise your hand, or if that's not available to you, please put your comments or questions in the chat, and I'll be assisting and moderating that as well. And Michael Dean Ignazio will be here to troubleshoot any tech issues. So if you're worried about any of your tech or information from behind the scenes, please feel free to use the chat box to reach out to Michael ahead of time. Okay, and we are ready to go, I believe. So that was all my, Dr. O'Hanley's finishing up class, just looking, so he will be joining us. Wonderful. Dr. O'Hanley is the faculty sponsor for all of the students here as well. So we've got, so what is this, jazz hands, for those of you that know the old, what is that, Bring It On movies. I'm aging myself there now, that comment, wow, okay. He will be joining us as well. So, and again, Diana has also put in the chat box the program. You did receive it in the email, but there's also a PDF version of it there, so you can kind of see the order of everything as well. So Mackenzie, are you ready to go? Mackenzie has got 4 presentations and we've kind of alternated her out, but Mackenzie, are you ready to go with your first presentation?
Yes, I am. I have a PowerPoint and I have an audio over it, so let me know if it doesn't play.
Okay.
Hi, my name is Mackenzie Feakin, and I'm a second-year graduate student in the school psychology program. We conducted a systematic review looking at how teachers are being trained to implement evidence-based practices for students with autism spectrum disorder. Although ASD is characterized by social deficits and restrictive and repetitive behaviors, teachers must be able to address the broad range of academic, social, and adaptive needs of these students. They can do this by using EBPs, which are interventions supported by large amounts of high-quality research, but teachers must implement EBPs with fidelity to produce positive student outcomes. To ensure EBPs are implemented with fidelity, teachers require proper training. Effective training is important, but is often limited for teachers at both the pre-service and in-service levels. Researchers did review the teacher training literature in 2015 for research published up to 2012, but the review had limitations. Our study is expanding what's previously been done by including paraprofessionals and pre-service teachers in addition to certificated teachers, and we are now including the 4 additional EBPs that have been identified since the last review. A review could help practitioners by increasing dissemination of training procedures and providing guidance based on a summary of the available empirical evidence. A review could also inform research by identifying gaps in the literature. We followed PRISMA methodology to guide our reviewing process. PRISMA is an evidence-based minimum set of reporting items for systematic reviews to basically ensure that our review is as high quality, inclusive, and transparent as possible. Our search terms were specific to the purposes of the study. Specifically, they were terms involving teacher training of EVPs for students with autism spectrum disorder. That search resulted in 2,100 articles, and after duplicates were removed, we were left with 1,700 articles to screen, which included reading the title and abstract for each article. From there, we weaned that down to 170 articles to move on to coding, and we ended with a final result of 71 articles to be included in the final review. The previous study done in 2015 found 23 articles in their final review. Our study includes an additional 48 articles for a total of 71 articles, which really highlights, one, how including more teachers may have captured more studies, and two, the proliferation of research since the previous review, and therefore highlights the importance of updating and extending the previous review. One positive finding regarding our first research question, which is what are the participant characteristics, was the high amount of paraprofessionals being trained, because paraprofessionals often spend the most one-on-one time with students and therefore have more opportunities to implement ABPs. However, general education teachers were included much less often. This is significant because gen ed teachers need adequate training if students with ASC are going to be included in the general education setting. Addressing our second research question, which is what are the training characteristics? We see here that 86% of trainers were the researchers. And while this is okay because researchers are presumably well trained to follow a specific teacher training procedure, which bolsters the internal validity of the study, there are also drawbacks to this. Specifically, it also means that when researchers leave the school site or complete their study, there may not be anyone on campus who can provide additional training or ongoing professional development to teachers. We also see that 46% of training occurred in a one-on-one format, and this too is okay because one-on-one training can be very effective. However, practically, it may not be the most efficient training format. Overall, these findings suggest that other training formats and possibly more efficient training formats such as remote training or small group training are understudied and warrant future evaluation. To address our third research question, what are the training components? We see that training generally involves a brief explanation of how to use the EVP and then more active elements such as modeling, practice, and feedback. We see that didactic instruction and feedback were used more frequently than other training procedures, while other methods like video modeling were less likely to be used. Only 11% of studies used video modeling. And since video modeling could be an efficient way to train teachers because the trainer doesn't need to be physically present, video modeling could be a way to increase dissemination and is ultimately an area of opportunity for researchers to look into. Some limitations of our study include that we may have missed studies during screening, but we did use and expand upon search terms that were consistently used in past studies. Also, our study was descriptive, so it's a little bit less clear which training procedures are most effective. This information could be evaluated by calculating effect sizes, which is what we're currently working on. Ultimately, by identifying and summarizing participant characteristics, training format, and training procedures, the results of this review can help increase dissemination of training procedures and identify gaps in the literature that can be addressed for future research to better support students with autism spectrum disorder.
Wonderful, Mackenzie. Thank you. Thank you. Does anybody have any? Sorry, go ahead, Mackenzie. Sorry.
Was the audio okay on that? Okay.
Does anybody have any comments or questions for Mackenzie?
Okay, I'll chime in. Mackenzie, how does a second-year student even start to tackle something this ambitious? I mean, starting with 2,100 articles, where was your mind at when you thought, yeah, I think I can do this?
Well, first, I have a really great mentor. Dr. O'Hanley has been so supportive and helpful and just amazing. And I'm really thankful for him. And also, I think I was a little bit naive and not really knowing like how much 2,100 articles really is. But I've been loving like the learning process, and I feel like I've just become such a better researcher and well-rounded future school psychologist. So yeah.
Cool. Mackenzie, I'm going to ask a question as well. Can you talk to us a little bit about what you've learned about doing a qualitative study, and what effect size do you think that you'll be looking at in the future for this study?
So the first part of that was, what have I learned?
Yes.
I think some of the biggest things I've learned in doing a qualitative study is really the importance of being extremely thorough in every single thing that you do. And especially when it comes down to the search terms, I feel like that has been one of the most important parts of this whole process, because the search terms are truly what help you identify the studies that are going to be in the review. And it's really important that you don't miss anything, so you can get as much information as possible. And also, just in doing the coding and screening procedures, it's extremely important for me to be really consistent in the way that I code things, so that when I go back and do the tables, it's a little bit easier. And then as far as the effect sizes, we haven't really talked about what that's going to look like, so I'm not quite sure how to speak to that question.
Okay, that's fair. That's good. From her cohort, her team members here, do any of you know about effect sizes, and any suggestions for what type of effect sizes you might look at? I know, asking a stats and methodology question. You weren't prepared for that, were you?
So I work with Mackenzie and Dr. Hanley, and we're looking at using like the Workbooks Clearinghouse. They set out like, I think they use R. It's like an effect size calculator where they just take basically images of each graph of each, right, and then it just converts it to what's the effect size? It's like single case design calculator for R. It's a
Good. Okay, wonderful. Any other comments or questions for Mackenzie for this particular presentation? No? Wonderful, awesome job, yay. Okay. So next on our list, we have Cassandra and Sandra. That must be fun, Cassandra and Sandra. Get my tongue around that. And present
Yes.
on training school psychology graduate students to conduct a preference assessment. So please go ahead, ladies.
I'm going to go ahead and share my screen and we'll present together. You can call me Sandy. That might break it up a little bit. Sandy and Sandra.
Yep, I think that helps a little bit too.
It does. Can you see my screen?
Yes.
All right.
Okay, so hi, I'm Cassandra Taylor.
We're also seeing your slide notes.
Oh, hold on one second. Let me stop sharing.
Yeah, you don't.
Which is fine. I mean,
But it's hard to see the actual slides, huh?
I know. Hold on. Let me reset that because it should have been. Just one quick second. Hold on. I'm going to close that and reopen one. Sorry. I'm glad we had the extra time, and it's like we're among friends here. So
yes, it's a nice small group.
This worked last time when we practiced this, so it's interesting. Oh, now it doesn't want to open. I'm so sorry. I had it all open and everything.
Take your time. Take your time. Michael, is there any suggestions for them how to open Zoom, or is it a PowerPoint or is it Prezi?
It's I've got it here. It's Google Slides. And there's a presenter view, and it should have been separate. Let me just share the correct. For some reason, it didn't share the right screen. So here it comes. Let me see if this works now. Is that better?
Yes.
There you go. Yes.
And you can't see my notes still?
Yeah. It looks
I'm not
good.
able to.
Okay, so you already know I'm Cassandra.
I'm Sandy Pearson.
And also, you know, we're from the school psychology program like everyone else, but our project is called Training School Psychology Graduate Students to Conduct a Preference Assessment. So disruptive behaviors are common in schools, and school psychologists frequently help develop behavior intervention plans for disruptive students. But in order for these plans to be effective, school psychologists need to identify items that can serve as reinforcers to increase positive behaviors. Preference assessments are a systematic way of identifying reinforcers. The multiple stimulus without replacement preference assessment, known as the MSWO, is brief and highly predictive of identifying reinforcers. The MSWO involves asking a student to select an item from an array of 5 to 7 items placed on a table. The consumed item is then removed and the remaining items are rotated, and the student is asked to select another item until all the items are gone. So in order for the MSWO to be implemented with fidelity, school psychologists need to be trained with direct training elements, such as those included in behavioral skills training, or otherwise known as BST. So BST includes didactic instruction, modeling, role play, and performance feedback. These training elements are often missing from applied training experiences. Training often focuses on didactic instruction, which doesn't give the opportunity to practice the steps. So BST has been used in university classrooms to train other professionals to implement the MSWO, but it has not been tested with pre-service school psychologists. The purpose of the study was to test the effects of behavioral skills training to train school psychology graduate students to implement the MSWO.
So for our study, we had 3 first-year school psychology graduate students that participated. It should be noted that all 32 students that were enrolled in the behavioral assessment and intervention course received the same training. And actually this training was conducted pre-COVID closures. So we were on campus for this. The behavioral skills training took place during a typical class, and the data was collected in a separate private clinic room. And a trained graduate student played the part of the Confederate child, selecting the reinforcers for the MSWO during the data collection process. All the materials were provided by the professor. Those items included a stopwatch, a checklist, and a variety of toys. We used a multiple baseline design across participants. And so for baseline data, the data was collected from participants who were asked to conduct the MSWO without any instruction, just come in and complete it. And then students then went into class, they received their behavioral skills training on conducting the MSWO. And then after the training, data was immediately collected again for the post-BST assessment. 1 week later, participants were brought back in and briefly reviewed the checklist during training, and then that they used during training, and then they attempted MSWO again to see how the training was maintained. Our dependent variable was the percentage of correctly implemented MSWO steps. Completing the MSWO involves several important steps as are listed here, but these include how to set up the assessment, how to interpret those results, and then what to do during the actual assessment. When kids were asked to select items, a number of things can happen, and it's important to know how to respond in each of those situations. Our results here show that during baseline, the participants' implementation accuracy was really low. There was a lot of guessing, and it was very interesting. They had no idea what they were doing. And then after the BST training, they showed significant improvement and were able to implement the MSWO with increased accuracy. Due to time constraints after class, we were only able to collect 1 data point, but the following week, they were given the same checklist that was provided in training to briefly review, and then they were asked again to conduct that MSWO, and the use of the checklist during maintenance increased implementation accuracy even more.
So in our study, BST led to substantial increases in the accuracy of MSWO implementation. The use of a checklist added to increase accuracy 1 week after training. These findings provide evidence that BST may be used in university classrooms to train pre-service school psychologists to implement the MSWO. This adds to the limited but emerging research on the use of BST in university classrooms. The limitations of the study were that only one data point was collected directly after BST, which decreases internal validity. Additionally, data was only collected for 3 students, so results may not be generalized for the entire class. Lastly, data was collected with a study confederate rather than a school-age child, which decreases external validity. Future research should identify how to collect more baseline and post-training data to enhance internal validity. Additionally, developing ways to test the effects of BST with a large group of students would help generalize results to a university classroom setting. And lastly, supplementing BST with technology such as video models may shorten the training time, making it more efficient. Okay, anybody have any questions?
You know, I'm going to ask one. So you mentioned that this study was done prior to COVID. So it was done in vivo, in person. And, you know, since then we've gone online, and you've also mentioned a few times, both in the research and one of your recommendations, the use of videos. So how would you, or what modifications would you do to this study if you were doing it now, video and not live in person?
You know, that's a really good question. And that's actually, there's training available with using video modeling. There's lots of modules and things like that online where a training video could be created and then passed out, you know, sent to all the students, to different programs, to you could use with teachers, all sorts of different people who work with students in this situation. My concern, like the area, I think that some limitations with that type of research would be making sure that it's being completed with fidelity, that the students are, or that those that are being trained are doing the steps appropriately, because there's not that you would have to be like a video conference type setup to see that work. So there is definitely some areas that could go.
Okay, and I think Dr. Ward has her hand up.
I'll try turning on my mic first, and then I'll ask my hypothetical question. Sandy and Cassandra, I see this as being something that is highly generalizable training, which really excites university trainers. As third-year students, can you think of another assessment that we could train on using the same techniques?
You want to go, Cassandra, or you want me?
I'm trying to think of, if you have ideas, go ahead and say them. I'm just trying to think.
You know, I think that there's lots of different interventions that there's so many different things, from like social skills training to different assessments, and we do use some sort of BST with a lot of our assessment training, but it's very generalizable, and something I would think like some social skills training and different interventions of that nature that could be used.
And then I have another question that's really kind of specific to the preference assessment that you guys used. Is the normative sample for that group, is it going to be pretty much with school-age children? Because I was watching your intro thinking, I think that where I would like to see that used would be in the preschool population, but I think they would have a really difficult time with not being able to keep the reinforcers.
Not being able to what?
Keep the reinforcers.
Okay, well, yeah, I think you can still use it with preschool children. You do let them play with it for a few seconds. And yes, you do take it back, unless it's an edible, because they do these studies with edibles too. So there might be something like a snack that they pick and then they eat it. So you can't take that back. So I could definitely see still using this with preschool students.
Okay.
And you can modify it too with less things. You don't have to have as many, you can do a smaller selection so there's not as much of a meltdown, but the having them play with it, because we're gonna, a lot of even our older students who might have like intellectual disabilities or different things of that nature would get upset from taking away, but that ability to play with it helps with moving the process along and selecting the next item.
And we taught the participants how to react to different situations. Like if the student grabs 2 toys at one time, or if they don't take any, or if they pick one and then go to pick another one. So it's like you learn how to like block so they can't have access to more than one thing at a time.
Excellent answers, ladies. Thank you.
Just for my own knowledge, is this something that is always done one-on-one between a therapist and a child, or can this be done in group settings as well? And how would that, if that is possible, how does that get modified?
I want to say I've heard of it done in group settings, but I think that would be more challenging because students might choose different things. So I don't know. What do you think, Sandy?
I haven't seen any research done in groups as far as, so for the MSWO, we were more focused on looking at the training of the school psychologists to implement this. And this is generally, like when you're doing preference assessments, it's generally more for specific, like if a student who has behavior concerns might be getting a BIP or of things of that nature. And so you're working more on a one-on-one setting. I don't know that the MSWO would be done, this particular preference assessment would be done in a group setting, just because there's the removal, without replacement, things of that nature. So,
okay, good.
That's
good.
true, because it really is identifying what's reinforcing to that particular student. So it might be something completely different for another student.
Right, good. Okay, thank you.
but I have seen research in like a class setting, like letting the class choose. There are different preference assessments for like classes, for like maybe disruptive class or something of that nature, and figuring out things, but that's a little bit different of a form of a preference assessment.
Okay, thank you. Thank you. Any other comments or questions for Cassandra or Sandy? No? Okay, awesome. Thank you. So our next two presenters are Mackenzie and Travis, and they are going to be presenting on Acting Natural, a review of studies focusing on training teachers to implement naturalistic interventions in discrete trial training with students with ASD. So Mackenzie and Travis.
You want me to take it away, Mackenzie? Okay, I'll handle this one. It's quite the mouthful for the title of the abstract, and it's extrapolating the study that Mackenzie's already spoken on. So I'll go ahead and get my video started for you all.
Just to clarify really quick, Travis is our third investigator on our big study. So he's been collecting IOA data for us and has been really helpful too. So.
Us.
Okay. Thank you, Mackenzie. Can everybody see this?
Good evening.
And hear it? Okay.
My name is Travis Goddard, and I'm a second-year graduate student in the school psychology program at Cal State San Bernardino. We conducted a systematic review looking at how teachers are being trained to implement evidence-based practices for students with autism spectrum disorder. Autism spectrum disorder is a neurodevelopmental disorder characterized by restrictive and repetitive behaviors and deficits in social communication, which impact academic, social, and adaptive functioning, creating unique barriers for teachers supporting these students in school settings. Discrete trial training is a systematic instructional approach with repeated learning trials in which a teacher provides an instruction, the student responds to the instruction, and a carefully selected consequence immediately follows, after which the teacher initiates subsequent learning trials. Due to the rigid structure of DTT, it can be effective in remediating academic deficits in students with ASD, such as discrimination training, for instance, distinguishing correct responses from incorrect responses. Naturalistic interventions include various strategies such as pivotal response training that involve arranging a student's natural learning environment, activities, and routines to increase the chances the student displays the target behaviors, which are met with natural reinforcers. For instance, to increase the student's expressive vocabulary, the teacher keeps snacks out of reach and gives the student the snack or a portion of the snack only if the student provides an appropriate verbal request. The adaptability and ecological control of NI make it ideal for producing positive outcomes for social skills and functional communication for students with ASD. For instance, teaching a student with ASD to express their wants and needs or to maintain eye contact when speaking with peers and teachers. Evidence-based practices are interventions supported by a large amount of high-quality research. Although there are currently 28 practices that have been identified to improve areas of need for students with ASD, the study focuses specifically on two of the most commonly used practices, discrete trial training and naturalistic interventions. Now, we can observe the positive effects of DTT and NI if they aren't implemented as intended, accurately and consistently. They must be implemented with fidelity. Unfortunately, teacher implementation fidelity tends to be inconsistent. One barrier to this is insufficient training at both pre-service and in-service levels. At the pre-service level, student teachers receive minimal exposure to DTT and NI. Training in-service teachers, those certificated in teaching, is also difficult due to logistical barriers such as time constraints and identifying qualified trainers. Also, even trained in-service teachers often require ongoing professional support to maintain competence with DTT and NI use in the instructional setting while managing competing demands. A review of training procedures is critical for individuals responsible for training teachers, such as university instructors and school-based consultants, who may benefit from having a summary of empirical evidence detailing the most effective and efficient methods to train teachers to implement DTT and NI with students with ASD. Previous research has reviewed both the literature on training change agents, such as parents, therapists, and teachers, to use DTT in 2019 and on training parents to use NI in 2014, but both studies had limitations. For instance, both reviews included studies involving the training of various caregivers in the use of DTT and NI with students with ASD as well as other disabilities. By refining the criteria targeting which individuals are being trained and the disabilities being serviced, our review may serve to further disseminate information about training procedures and components being utilized and to expose areas in need of improvement. Our three research questions are: what are the participant characteristics involved in training? What are the training conditions? And what are the training procedures? We followed PRISMA methodology and evidence-based minimum set of reporting items for systematic reviews to ensure that our review is high quality, inclusive, and as transparent as possible. The search terms used were specific to the scope and purpose of the study, involving teacher training of EBPs for students with ASD. The final review included a total of 28 articles. General education teachers received far less training, emphasizing an even greater need for quality training to facilitate the integration of our students into inclusive classrooms. Notice that 28% of the participants trained were paraprofessionals. This is a promising finding as paraprofessionals typically spend the most one-on-one time with students, allowing them more opportunities to directly implement EBPs. Another significant finding indicated that less than 3% of teachers worked in secondary settings. Adolescents with ASD have different needs than younger students with ASD. For example, high school students with ASD must have the experiences, skills, and transitional supports to succeed in a competitive job market after high school. This lack of training in the use of DTT and NI in middle and high schools reveals opportunities for future research. 82% of trainers were the researchers. While researchers are likely qualified to teach the DTT and NI they are investigating, there are drawbacks. Specifically, when researchers leave the site, there may be no one on site qualified to provide training or ongoing professional development to the teachers. 32% of training occurred in a one-on-one format. One-on-one training can be very effective, although it may not be the most efficient format. Overall, findings suggest that other formats, such as remote or small group training, are understudied and warrant future evaluation. Training generally involved a brief explanation of the EBP, such as the DTT and NI, paired with more interactive methods such as modeling, practice, and feedback. We see that didactic instruction and feedback were used frequently, while other components like video modeling were used far less. In fact, only 11% of the studies used video modeling, despite the potential efficiency of video modeling in training teachers, as the trainer need not be physically present. With so few studies utilizing video modeling for training, future research might investigate its feasibility in training staff. While we may have missed studies during screening, we did use and expand upon search terms consistently used in past studies. As a descriptive study, it is less clear which components are most effective. However, this information could be obtained by calculating effect sizes, which is what we're currently working on. In summarized participant characteristics, training formats, and procedures, this review serves to further disseminate training procedures as they relate to the use of DTT and NI in the instructional setting. and to expose gaps in the literature that can be investigated in future research. That concludes my presentation. Thank you so much for your time.
Wonderful. Thank you, Travis and Mackenzie. Good to see that you are, well, it sounds like a very large study that you're doing, that you were all involved in. So I'll open the floor up. Are there any questions or comments for Travis or Mackenzie? I think Dr. Ward has her hand up there.
That's shocking, right? Travis,
Yes.
where the fidelity came in.
I'm sorry.
I'm missing where the fidelity piece to this study came in.
Mackenzie, would you care to answer that since you've had a little bit more experience with it?
Yeah, so the bigger study is looking at training teachers to increase fidelity. And so specifically with DTT and NI, we're looking at how to train teachers to increase their fidelity in implementing those two specific interventions. And so that's kind of what we were reviewing, how well they're being trained to implement those two interventions. Does that answer your question, Dr. Ward?
A little bit. I think, you know what it is? It went so fast. I didn't get a chance to really look at your charts, and my screen is only this big. All of you guys are like this big. So I think I'm just missing something as it went by too quickly. So I apologize for that, but I'm always